of you that read Sherlock Holmes know about the name Moriarty. This is not the one. This is a much more futuristic approach, the place of apheresis and the way you could work with it. Please go ahead.
Thank you. Buongiorno a tutti. I'm trying to look at my slides. They're not. Okay, thank you. Unlike the previous speaker, I'm going to be talking about genetic disease. And these are my declarations. So, as background, familial hypercholesterolemia is one of the most common genetic defects in the world. Roughly 1 in 200 people have this disease. And basically, they have very high LDL cholesterols at birth, resulting in a very high risk of premature cardiovascular disease. So despite lipid-lowering therapy, such as statins, azitamides, and so forth, most or some of these patients don't reach their goal. And due to that fact, we have to try other therapies. And presently, for the last 20 years or more, the therapy that's been used is something called apheresis. This is a term that's Greek for meaning taking away. And apheresis is similar to dialysis, but lipoprotein apheresis specifically removes ApoB lipoproteins, such as LDL cholesterol, about 75% per procedure. And this trial was designated to clarify whether adding alirocumab, which is a PCSK9 inhibitor, which was approved over a year ago in the United States and in Europe, could reduce or eliminate these apheresis therapies, which once a patient starts these therapies of apheresis, they have to do it every once a week or every 2 weeks for the rest of their lives. And it's a very invasive procedure where it involves IVs to both arms. It takes about 3 or 4 hours, and it's very, very costly. So the design of the study was basically at a screening period of 2 weeks, and we broke the patients down to 2 groups. Both groups started with apheresis, but one group started apheresis with alirocumab, 150 milligrams every 2 weeks. They received the injections immediately after the procedure. After 6 weeks, we then evaluated who would need apheresis further during that time period compared to the placebo group. Now, how we designated this treatment lowers LDL by 75%, apheresis, acutely. But chronically, over the 2-week period, the mean reduction of LDL, if you look at it from start to the next treatment, it's about 30%. So we said, let's see if alirocumab can lower LDL by over 30% compared to the placebo group. And if it does, then we don't need to treat those patients because they're basically getting the same benefit as the apheresis. And these are the results. We showed a 75% reduction of treatments with apheresis on these patients who were put on alirocumab once every 2 weeks. As you can see down here, this is a listing of the treatments that were used for these patients, apheresis treatments, from week 7 to week 18. And over to the left, you'll see over 60% of patients had no treatments of apheresis after week 6 because their LDL reduction was more than 30% compared to apheresis without the drug, that more than 60% did not need apheresis therapy. And over 90% of patients had more than a 50% reduction of apheresis therapy over this 18-week period, greatly reducing the need for therapy with this device, with these machines. And here's the time average cholesterol concentrations of these patients, showing the placebo on the arm here. I don't know if this works or not. This is apheresis alone without the PCSK9 inhibitor. And down here is starting the PCSK9 inhibitor with the apheresis, and then by week 10 you see a significant reduction, where by week 6 we had a 53% reduction of LDL on top of the apheresis with the alirocumab group, compared to only 1.6% reduction with the apheresis only, and by week 18 it was still about 42%. What about safety? That's always an important thing. Well, as you can see here, these so-called treatment emergent adverse events, compared to with the treated group, compared to the placebo group, it was very, very similar. Not really much difference whatsoever in AEs. So, in conclusion, HeFH, which occurs in approximately 1 in 200 patients, and by the way, in the United States, less than 5% of people who have FH know they have FH. It's a very misdiagnosed disease, unfortunately, in the United States. And without effective treatment, there was a high risk of premature cardiovascular disease. In the Odyssey Escape trial, alirocumab significantly reduced the need for apheresis treatment by 75% versus the placebo group. In patients receiving alirocumab, apheresis was discontinued in 63% of patients, and the LDL cholesterol was reduced by approximately 50% from baseline versus only 2% in the apheresis-only group. Finally, treatment with alirocumab 150 milligrams every 2 weeks may allow patients with heterozygote FH to terminate or even reduce their frequency of lipoprotein apheresis. I thank you and open for questions.
Thank you very much. Just a quick question from my
Yes.
side. What's the price difference? What's the cost?
Say that again.
The cost of the two alternatives.
Apheresis can cost $50,000 to $75,000 a year, and the drug, I don't know, I think it's $7,000 to $10,000 a year, depending on what country and so forth.
So
it's about at least a 5 to 1 ratio difference of less costs with the medication.
Good. Questions?
Yeah, Bruce Jansen, Cardiology News. Were these all adult patients?
These are all adult, 18 years and older.
Okay. Would you, based on your results, use this therapy
I have.
younger?
For patients who have apheresis, yes. I mean,
Patients who have the familial hypercholesterolemia?
yes, we have already. We have, at my center, we have the largest apheresis center in North America, and we treat these patients every 2 weeks. And I've now started weaning them off the treatment of apheresis with these drugs. I haven't been successful getting them all off, but it's a case by case. Some get treatment less often, and some actually do get off therapy. So for the young folks who have FH with ongoing cardiovascular disease, I have been initiating therapy for some of those, instead of having them come in for apheresis every 2 weeks.
Here in the first row.
Yes.
Oh, hey, John
sir.
Gardner with EP Vantage.
Hi, John.
Dr. Perk asked my first question.
Yes.
The second question I have is there any reason to believe that this is unique to alirocumab, or would it apply also to evolocumab or any of the PCSK9s that come along after it?
Well, since we didn't do a head-to-head, I can't, exactly say that, but my assumption clinically and professionally, I would say yes, it probably is a class effect. But we are actually at the moment involved in a trial with Amgen's drug 2 in the similar patient population, but not of this type. It's a similar one, but a little bit different.
Okay, go ahead.
That was a good question. Yes.
Crystal Fenn with MedPage Today.
Hi.
Is a 30% reduction enough, satisfying, or would you
Good
consider
question.
combination?
Yeah, that's a very good question. And personally, no, not for all of them. As I said, we're only getting to the mean of the LDL reduction that the treatment of the apheresis does. So it doesn't mean in all these patients that I showed you, the 63% that stopped apheresis, it doesn't mean they all reached their goal. A good percentage of them did reach their goal, but it's not 100%. So it varies for each patient. But one thing it does, it lowers the treatment for some patients from every 2 weeks to not at all, or every 2 weeks to once a month, or once every 2 months. So it's definitely an added ammunition in treating these patients' disease and risk, which is their LDL cholesterol and their premature cardiovascular disease.
Do you have any plans to study the combination versus,
Combination of what?
well, in this trial, if I understood correctly, if patients got to that 30%
They stopped.
reduction, they stopped.
Yes.
But what if they got to that 30% and you continued both together? Is
Yep.
that studied somewhere else, or?
I'm doing it now in my
Right,
clinic.
okay.
I have patients I'm trying on the machine, trying with the drugs and seeing how well the LDL goes down, and then determining from that how often we need to treat them. If their mean baseline goes down to a therapeutic level that you want, then you can kind of back off a little bit. And some, as I said earlier, can get off apheresis completely. Some can't completely. So it's a case by case, but it's definitely something more we can use.
Yes, next question.
Janine Benning, Medical Facts. Just to
Hi.
clarify, you said 1 in 200 patients have this genetic disorder, and 5% of those patients do not respond to.
No.
How-
The FH is 2 major types. It's also
Yes.
called homozygote, which is very rare. It's 1 in 200,000 now. And then the heterozygote, which means you get one genetic defect from a parent, is about 1 in 200. What I said in the United States, since we have 1 in 200, there's quite a few people who have it. Unfortunately, less than 5% of people who do have it know they have it. Because they
Okay.
weren't told by their clinician that they have this disease until I see them when they're in the 40s and 50s with disease, and I say, well, you have FH. And they go, who's that? They don't
Okay.
know. It's,
And this apheresis therapy
Yes.
is for patients that do not respond to standard medication.
Exactly,
What
yes.
percentage of patients are that?
not too many, and for example, in Germany, which is the largest apheresis centers in the world, they treat about 2,000 patients. And their population is about one-sixth the United States. In the United States, we treat about 500. It's a very small group. And unfortunately, it should be larger in the United States, but knowledge of apheresis is very low in the United States. There's only about 40 apheresis centers throughout the United States. There are very few. So there's a lot of patients in the United States that probably need the therapy, but for reasons I can't answer, they're not getting it.
Last question.
Lynn Peterson from Trends in Medicine.
Where are you?
Could
Oh,
I-
hi.
Hi. So could I just ask the panel, please? So in a sense, I'd like to understand how the adoption of PCSK9s is going outside of the U.S. So Dr. Perk, perhaps, and maybe Dr. Domberg could tell us how you're using PCSK9s there?
Well, I don't have the overview for the central and southern part of
But
Europe.
you-
In the northern
in
part,
Europe.
it's trickling in, but it's still not common practice. Okay, let's go on to
Thank
the
you.
next presentation.